I'm going to move us into the next portion of our agenda, after which we'll take a break. But the next agenda topic is Ontario's strategy to end human trafficking. And I understand there was a good, robust discussion with families a few weeks ago on this topic. But we just wanted to bring it up at this gathering as well, just to continue on with the discussion. So I'd invite, who's doing it? You gotta go. So we have till about 2 o'clock on this particular topic. So.
So if you just want to pull up the strategy to end human trafficking presentation. Oh, let me just take a look. One second. Okay, so if we just want to pull up the anti-human trafficking presentation. So just wanted to let you folks know that, and we'll discuss this as part of the presentation, but we do have now an anti-human trafficking provincial coordination office in the government that was actually established as part of this strategy. And they're actually leading the work now and coordinating all of the different initiatives under the strategy. So unfortunately, they were not able to be here today to present to you folks on the strategy. But since our ministry has been involved in the development, we said we'll do a presentation anyway, just so that we can get some feedback. But just recognizing that there may be some questions that I'll have to take back to them and may not have the answers on. And we can give you folks an email for the office as well after this if you want to send in any comments as well. But just want to let you know that there may be some technical process related stuff that we may not have the answers to today, but we'll try to answer as best we can. So if we go to second slide here, human trafficking in Ontario, a snapshot. Just to give an idea of what we're talking about when we refer to human trafficking. So really it's a complex and multifaceted crime and a human rights violation that results in a very specific type of trauma, a very serious type of trauma. It's often a hidden crime as well, which is a real issue in terms of responding to it and in terms of identifying victims and bringing victims out of trafficking, as well as something that crosses multiple jurisdictions. So that is also a challenge in terms of the response to human trafficking and where to target efforts, because it does move different boundaries. It affects various groups, and we'll talk about who's vulnerable, and requires dedicated responses. And the primary types of human trafficking that our strategy is focusing on are trafficking for sexual exploitation, so sex trafficking, as well as trafficking for labor exploitation. Sex trafficking refers to sexual exploitation of persons' control of their movement, direction of their movement, administration of types of coercion like drugs, etc. Whereas labor trafficking or labor exploitation refers more to, in the transnational context usually, exploiting people for the purposes of forced labor. So just to provide that clarification. So in terms of research and consultation that we've done so far, areas that report high numbers of human trafficking are concentrated in the GTA and Golden Horseshoe, so really looking at the border between Canada and the US, but also hearing that it is a rising concern in rural and remote areas of Ontario as well. And also heard from Indigenous communities and leaders that it's a significant issue in areas in Thunder Bay, as well as in the Ottawa region, particularly with respect to the Inuit communities there. So when we talk about human trafficking in Ontario, we are considered a hub for human trafficking in Canada. Roughly 65% of Canada's police reported cases, although we'll temper that by saying that we do have more capacity to respond in Ontario, so more charges are laid, which sort of impacts how the statistics are captured. Of those cases, the majority of those are for sexual exploitation, and most of those are actually domestic victims rather than transnational victims. So those are people who were born in Canada and are being victimized in Canada. In terms of vulnerable groups, we know that young women and girls, as well as young boys, are very at risk for trafficking. In particular, we know Indigenous women and girls. There's been a lot of work done on this by the Ontario Native Women's Association, so we took that into account when we were developing the strategy. And as well as youth in care and at-risk youth. looking at migrant workers and foreign nationals and newcomers, also very vulnerable for both forced labor trafficking and sex trafficking. Individuals who may be working in the sex trade, engaged in sex work, as well as persons with mental health and addictions issues. So these are some of the key groups that we've sort of been focusing on in the strategies approach. If we go to the next slide, just wanted to recognize some of the historical legacies and links when we talk about the trafficking of Indigenous peoples. We know that it's strongly linked to very specific historical, institutional, and socioeconomic factors. When it comes to the impacts of colonization and racism, there are like specific legacies of exploitation, in particular with respect to Indigenous women, commodification of Indigenous women's bodies, things like that we're very aware of. And so we also know that it's linked to a number of other issues, and we'll mention this when we talk about missing persons, but missing persons legislation that we're going to talk about will also help to respond to this issue. So a lot of links there. And something that we really did take into account when developing the initial strategy framework. So if we go to the next slide, just to give you an idea, so last year in February, the Premier announced that she did want to develop a strategy to end human trafficking. And so we were directed to go out and do a whole bunch of consultation on what that strategy could look like and the framework for that strategy. So between February and June, there were a number of different consultations with diverse stakeholders and partners. We included the roundtable on violence against Aboriginal women, the joint working group with our Indigenous partners, as well as we did have a session here in Thunder Bay with survivors of human trafficking and with service providers to get the specific Indigenous perspective. So we identified a number of issues to address through the strategy as part of that consultation. The first one is really recognizing that Indigenous women and girls are overrepresented in sex trafficking in specific in certain regions in Ontario. We heard a lot too about vulnerability when people are coming from remote and fly-in communities. They're moving to a different community where they maybe don't have services and supports, or they're not with their family, and how that can make people particularly vulnerable to trafficking. And so really what we heard from this is that we need to make sure that we're supporting Indigenous-led and Indigenous-specific services and supports for survivors of human trafficking. So we can't just rely on mainstream supports. We need to make sure that's a dedicated focus of the strategy. And you'll see, I'll talk about how that's been incorporated into the strategy's framework. Human trafficking survivors often struggle to access the range of benefits and services that they need. So human trafficking survivors have a very specific type of trauma because their movements have been directed, they may have been confined. It's very different from different types of trauma that may be experienced by other types of victims like sexual violence or domestic violence or other contexts. So very specific services are needed to target towards that type of trauma. And really what we heard is that survivors need a continuum of care. So they need a whole bunch of different services. For example, when someone exits human trafficking, they may not even have like a bank card, access to any kind of money. They may not have anyone to reach out to. They may have addictions issues that they're dealing with. And so those are multiple different things that they need sort of a wraparound response to. Responses to victimization centering around the needs, beliefs, and interests of survivors. So this is the idea that survivors know best what they need, and survivors of human trafficking can advise the best on what other survivors might need when they're exiting human trafficking, rather than imposing what we think that they might need. And so looking at survivor-centered approaches that give them with options and autonomy in their decision making. And also a desire for survivors to be included in the development of programs, policies, and strategies. So not only serving survivors and helping them to exit human trafficking, but actually empowering them as part of that process. So for example, looking at peer support networks or peer-led outreach, where it's peer-to-peer. And then early intervention and prevention measures are necessary for those who may be at risk of being targeted for human trafficking. And this was a big one when we did our engagement with Indigenous communities, in particular having those culturally responsive services and connection to cultural services and cultural agencies to prevent someone from falling into human trafficking in the first place. And so we really did hear that in terms of the approaches that we need to go forward with. So if we go to the next slide on Ontario's strategy to end human trafficking. So in June of last year, we did announce a framework for the strategy to end human trafficking and sort of our key pillars and our key focus areas. The announcement did include up to $72 million in investments aimed at these 4 pillars. Now, the details of how that funding is distributed is actually being determined as part of the budget that's being worked up. And so when the budget is released, then we're going to get the details on how that sort of funding is going to be distributed and all of those things. So that's still to be determined. But in terms of where the strategy focuses, there's really 4 key pillars. So the first one is around provincial coordination and leadership. So the big piece that we heard is that there's really a lack of coordination among local agencies, as well as a lack of coordination in government to actually address this issue, because human trafficking does touch so many different areas, right? Law enforcement and justice, social health, education. So what the proposal was to establish an anti-human trafficking coordination office in the government that would be responsible for leading and implementing this strategy. I also want to mention as well that so that office is just ramping up, just starting to hire its staff. And we did confirm with them that they will be looking to have an Indigenous person as part of the office as well, to make sure that there is that expertise to advise on Indigenous specific initiatives. So that will be a key part of that expertise. Prevention and community supports is the second pillar. And this is really around increasing awareness and understanding of the causes of human trafficking, and increasing community services to meet those both immediate and long-term needs of human trafficking survivors. As I mentioned, it's a very specific type of trauma, so we need these dedicated and specific responses, both for the short and the long term. Enhanced justice sector initiatives focuses around intelligence gathering, identification of victims, and then investigations. So right now, there's very limited capacity to investigate human trafficking in some areas. There's issues with not having the intelligence in place to know, like, for example, what organized crime groups are involved, so that you can sort of proactively respond. And so our ministry and Ministry of the Attorney General are looking to ramp up some resources there and some strategies there to make sure that there are more supports in place. Finally, Indigenous-led approaches. So recognizing that we did hear the feedback that Indigenous, in particular women and girls, are very, very at risk, and that specific culturally responsive approaches are needed, we actually included a separate pillar just to focus on Indigenous-led approaches. And as part of that pillar, looking at supporting Indigenous organizations in delivering culturally relevant resources and responses that are designed, developed, and delivered jointly with Indigenous partners. So that's a key pillar of our approach. So if we go to the next slide, just a brief update on some of the strategies initiatives. As I mentioned, we don't lead some of the initiatives, so if you do have questions, we can take those back and get answers for you, but just to give you a flavor of what the work has been to date. So for the Provincial Anti-Human Trafficking Coordination Office, they've started to do some work around what they're leading. And the office is actually leading some of the Indigenous-led approaches and working with Indigenous communities to work those up. So one of those is an Indigenous-led initiatives fund, which is to provide dedicated services and supports to survivors of human trafficking, as well as target those who may be at risk. And that would be Indigenous organizations delivering those services and supports to their community members. So between January and March of this year, the Anti-Human Trafficking Coordination Office has engaged with close to 50 Indigenous organizations and communities on the design and the delivery of that fund. So some of you may have been included in that process as well, and there's been a lot of work there. And as well, there is another fund being developed for mainstream services and supports for survivors of human trafficking, which is called the Community-Based Supports Fund. And there's been a lot of different consultation on that as well. So 12 anti-human trafficking coalitions have been engaged, representing close to 160 different organizations and groups. So a lot of engagement on what those funds should look like to make sure that they're effective in responding to survivors of human trafficking. Ministry of Health and Long-Term Care is leading some work around evidence-based training and culturally sensitive resources to make sure that mental health and addiction agencies are aware of human trafficking survivor care and can respond effectively. Ministry of the Attorney General is looking at creating a provincial human trafficking prosecution team because we do know there's quite a few issues right now with prosecutors not knowing how to lay a human trafficking charge, not having that knowledge, and not being able to effectively prosecute it to actually hold offenders accountable. So that's a key piece as well. And a Crown coordinator has been brought on to lead that team, and they'll be doing the recruiting for those specialized prosecutors as well. So if we go to the next slide. In terms of our ministry's work, we're looking at, again, improving that intelligence-led policing when it comes to human trafficking, improving training, as well as improving investigations and response. So greater resources in the Criminal Intelligence Service of Ontario, which does that intelligence analysis. So they do, for example, threat assessments where they look at what organized crime groups may be involved in human trafficking, and that allows for a more proactive and better response where you can understand what groups are involved and where you should be targeting your policing responses. Also looking at the Ontario Police College training and creating a new human trafficking training program for police recruits and senior specialized officers in Ontario. So focusing around being able to identify survivors and respond and intervene with survivors in a manner that is trauma-informed and that actually understands that sort of unique crime that is human trafficking and how people experience that. So that's some of the work underway there. And then finally, at Children and Youth Services, looking at, first of all, protocols between children's aid societies and police services to proactively identify youth who may be at risk of human trafficking. So there's a very effective protocol in the York region that identifies sort of the relationship that should be in place between children's aid and police to make sure that youth in care are not falling into human trafficking situations. So looking at developing a province-wide sort of guidance protocol. And as part of that, definitely would be looking for Indigenous input down the road there and input from First Nation partners. And then looking at expansion of supports for youth in transition, so youth who are leaving the care of children's aid societies or from Indigenous well-being societies. So that's some of the work that's already underway. If we go to the next slide, Indigenous-led approaches. So really the Indigenous-led approaches pillar focuses on three key pieces. So prevention and public awareness resources on human trafficking through culturally appropriate and gender lenses, establishing Indigenous anti-human trafficking liaisons, and these liaisons would support targeted service planning and delivery through Indigenous organizations, and an Indigenous-led initiatives fund to support community-focused projects for survivors of human trafficking to provide services and supports. So all of these are intended to be working with Indigenous organizations for Indigenous organizations to deliver these things. So it wouldn't be a mainstream or the ministry delivering, it would be actually led by Indigenous partners. With respect to the anti-human trafficking liaisons, those actually have been rolled out, and the Ontario Native Women's Association was selected to deliver the overall program, which is in a bunch of different places. So Toronto, Windsor, Thunder Bay, Ottawa, as well as some remote areas as well. And what they'll be doing is consulting with other Indigenous partners to support these liaison positions that will then provide advice and training with respect to human trafficking. They will support responses, they will identify gaps in services in communities, and they will also help to design and deliver this Indigenous-led initiatives fund. And the idea there is to start to build capacity to the point that was made this morning about, there might be a lack of capacity in northern or more remote or communities that don't have that capacity now. The idea is those liaisons help to build that capacity, and then the fund is rolled out, and Indigenous organizations are then able to start delivering services and supports to better respond to human trafficking in Indigenous communities. And so this has really been informed by a lot of different engagement and leveraging different engagement networks across ministries. As you can see, even though we're not leading the file, we're coming to talk to you folks today because we're really trying to look at every input that we can, or every opportunity that we can get to talk to different Indigenous partners about these initiatives and what they should look like. So if we go to the next slide, the Indigenous-led Initiatives Fund, as I mentioned, there's been a lot of engagement on that already taking place. It started in February, has been going through to March, April. So the Anti-Human Trafficking Office has engaged with over 40 First Nations, as well as Métis and Inuit organizations on the design and the delivery of this fund, and gotten a lot of really valuable feedback on this. So they've heard that communities in fly-in, rural, remote settings, for example, need time to build more capacity, as I mentioned, in the area of human trafficking, and that human and financial resources are required to support applicants in applying for this Indigenous-led Initiatives Fund. That there needs to be a coordinated approach to address human trafficking at the local, regional, and provincial level, that communities need to do the planning part first and then do the implementing. That a number of different partners need to be involved, for example, police, child welfare, social services, etc. That the response system needs to be inclusive to people with lived experience and sort of respond to their stages in their journey. and that Northern Ontario has very unique needs that need to be considered when designing programming. So the current status on that is, so the office has taken that feedback now and is now looking at how to develop that fund in a way that supports that capacity planning phase as well as that implementation phase. So they're taking that back and starting to do that work up. And I know they were at the February meeting that we had in Thunder Bay as well, so probably some of you were able to provide input at that point on the delivery of the fund. So they're really taking that feedback and starting to incorporate it in that sense. And so today, because the engagement to date, a lot of it is focused on the fund, and we have received a lot of input there, we wanted to focus your attention more on the prevention measures. So looking at prevention, whether it's looking at public awareness campaigns locally or whether it's looking at preventative programming. That is another piece, another initiative under the Indigenous-led approaches pillar. So on the next slide, we have a couple of questions about public awareness and prevention to help us start to scope out what that work looks like. So in terms of what you think the best method is of promoting prevention and awareness with respect to human trafficking of Indigenous peoples. So is it online to reach youth? Is it local community resources may be provided in an Indigenous organization? And should these be province-wide or should they be targeted to specific areas? Are there specific hotspots or areas that you think this is particularly needed? How can Indigenous organizations, or how should they be involved in the delivery? So what would be sort of your preferred method of being involved in delivering these services? And what specific outcomes would you like to see these measures achieve for Indigenous people? So, for example, increased understanding of the signs and patterns of human trafficking, and how do you feel we could evaluate those outcomes in a way that is culturally appropriate and respectful of how that issue is impacting your communities? So just a couple of questions there, but welcome any thoughts on any of the other pieces as well. Yes.
I know it's supposed to be working. I guess just in regards to the whole Indigenous liaison, just in regards to the whole liaison portion of the anti-human trafficking strategy. It was very prescriptive and limited.
Okay.
The amount of funding for the Indigenous caucus partners, I think there's 6 or 7 of us, and it's worked up to $70,000 per year to do all this work and to consult with our groups. Like I'm with the Chiefs of Ontario, so I'll be working with the PTOs. And we know that the Grand Council Treaty 3 has their own strategy. They've applied for funding, they were denied. Same thing with the Mishnabek territory too. They were told, no, you can't apply because you're not a provincially oriented organization. But some of the PTOs have done a lot of work in regards to human trafficking. I know that the executive committee for the Women's Council and Treaty 3 have worked quite closely with Diane Redsky, and for Indigenous, for someone who's Indigenous and a knowledge holder in regards to human trafficking, they should have been funded for the work that they're doing and that they're trying to do. Yeah. So it was very limited and very prescriptive, and I think it was pretty disappointing for the PTOs, and especially at the First Nation Women's Caucus within the Chiefs of Ontario. They did not agree with that. And I also know that because I sit on the Indigenous Caucus for the former joint working group, they're also very disappointed with the limited funds as well.
Right. So I will definitely take that feedback back to the office because they led the development of the whole liaisons process. So that's really good for them to hear. I do know that in terms of like prioritizing the funding, I do know they wanted to put more priority on the Indigenous-led initiatives fund in terms of like getting those services and supports out the door for survivors. So maybe that factored into sort of the decisions around what gets prioritized now versus later. So I'll take it back to them for the fund that they're developing now to make sure that that's a consideration in terms of the PTOs having access. So thank you. Yes.
Yeah, I just wanted to comment. I was again taking in all everything that was the work that's been done today. But also thinking about our First Nation communities and why our sisters leave the communities. Through personal experience, I had one sister and now I have one niece. They left the community. And I want to say this because it goes back to the First Nations communities themselves. When we don't have the essential services or the required services for their support and protection, they have no choice but to leave. And it's because very different issues like marital breakdown, family violence, addictions. We see a lot of our young people leave. And I don't know if that's been mentioned where at the First Nations level, we need to do more as well. Where we need to work at finding a way to support our sisters or brothers that find themselves in that situation where they have to leave. And a lot of times it's a lack of housing, lack of services in different areas like housing, mental health support services or family support services. One of the biggest issues at our community level too is lateral violence. I think sometimes we need to kind of look at ourselves too. It's not always pointing out, but looking in and seeing what we're doing for ourselves as a community member, for our community citizens. I just wanted to share that because I hear what people are saying, and I see it myself, where I experience it myself, where we see our own people leaving. Even just last night coming here, driving in from Timmins, we passed through Wonglac, and you know how the town is separated with the reserve. There's a bridge that spans the river. There was a young girl approaching the bridge, going into town, and it was midnight, all by herself. I don't know, I'm just mentioning that because it's, I guess there's so much vulnerability out there. And we just need to be more aware of it. Take the right steps, I guess. Yeah.
Thank you. Yeah, I really appreciate that point because it is so key, the issue of people leaving communities, right? And seeing that people are leaving communities and that making them at risk for human trafficking. As part of the Indigenous-led Initiatives Fund, there's been a lot of talk around that and whether we can support projects, for example, that there's a component where if they see that there's a number of people that they're serving that are coming from another community, that maybe they collaborate and engage with the agencies in that community to make sure that there's communication there, right? So there's a way of maybe stemming the root cause and recognizing who's at risk. So I think a key piece of any of these like funds and measures is going to be the collaboration between different communities, because for human trafficking, it's people leaving the community, they're traveling around the province, and there's got to be that collaboration and there's got to be working together. So that is an excellent point. So thank you. Hi.
So I think like some of the things that were missing from your presentation is I talked about Bill C-36 and also the distinctions between the Swedish model and the Nordic model and sort of how those affect people who are like workers right now. So like I think that's something that needs to also be talked about. Yeah, it's missing. Yeah. C-36 doesn't actually prevent Indigenous women who are in those industries from violence.
Right. Yeah, I appreciate that feedback because as part of the whole development of this strategy, there's been a lot of talk too about how to distinguish human trafficking from consensual sex work, right? And there's a lot of different perspectives where some people say like that's my choice and yeah, I should be allowed to engage with that, and there's people who say, well, this person's being exploited. So it is a key part of everything under this. The training, the funds is to be able to understand exploitation, what human trafficking looks like, and then adequately and effectively respond to make sure that people are in safety. So thank you for raising that. Yes, go ahead.
Thank you. My name is Stephanie. I'm the Senior Policy Analyst for the Deputy Branch and Deputy Action in this convention. question or the explanation. Something that recurs in some of our conversations that we have with our communities is that, of course, we've got the lack of capacity and the lack of self-development of staff to be prepared to even begin to have these discussions with our community members. And a lot of times these conversations are only going to be triggering some situations that are occurring amongst themselves as well too. So we've got to make sure that our community frontline workers are prepared and have that support to be able to provide a service to the community members. Has there been talk about a risk assessment tool or anything that can be used in a preventative measure? Is there something like that?
Yeah, I mean, that's a great point, right? Like, and we
want to look at supporting Indigenous organizations to develop responses that are tailored to local needs too. So if there's a risk assessment tool that doesn't work in your community, for example, it's not culturally responsive, we don't want to be imposing that on anyone. But I think that is a key piece for the fund anyway, is to look at, as part of that initial capacity planning, assessing community risks and preparing people to respond to those risks. So I will bring that back to the office and let them know that the risk assessment is part of that. Thank you. Any other thoughts on this piece? Okay, well, that concludes human trafficking. And I think next up on the agenda is missing persons, but I think we might take a break. 10 minutes? Break? Sure. Okay. Sorry, I'm not the facilitator. I'm like, smoking.